All right, now almost all of us have heard the phrase, it takes a village to raise a child, right? Well, there's an organization here in our state that takes that to heart.
Hector Glynn, the president and CEO of the Villages for Families and Children, here with us now to show us how. Hector, thanks so much for being here. We appreciate your time. You have, obviously, you said 17 years you've been with this organization, so it means a lot to you, I'm sure, personally, too, right?
You know, we're a mission-driven organization, and we really want to strengthen communities and make sure that in times of stress, when people are struggling, they know that there's someone out there for them.
And Hector, you're here as part of our collaboration each month with the Department of Children and Families. What is the most important message, would you say, that you want to get out to parents right now when it comes to, you know, for example, teens' mental health?
So we're still in a children's mental health crisis. The Department of Children and Family 2 years ago funded a brand new level of care, not a program, but a level of care, which we call the Urgent Crisis Center, or UCC. And really the idea there was that emergency rooms are not the right place for children who are in behavioral health crisis. If you can think about, you know, being overstimulated or being through depression or just having intense anxiety, and then being thrown into an emerging room where there's lights and there's a lot of noise and commotion, that doesn't begin the healing process. And so in designing a therapeutic space that allows us to take the time, about 4 or 5 hours, to do a good assessment and then connect those families to care, we hope to change the trajectory of those children's lives.
So Hector, can you tell us a little about what the the UCC. I'm assuming that there's probably one person who's going to be sitting with you the whole time. You're not going to be seeing multiple people, which could cause more confusion.
No, it's actually the opposite. So we take a multidisciplinary approach. And now, if you think about an emergency room, one of the first places people you see are the nurses.
Right.
Because there might be a medical component, right, where you want a medication that it caused something, or did something else change. So we want to medically clear you and make sure that that's not what's driving sort of whatever issues brought you to the UCCs. And then, you know, we want to work, maybe separate mother and child, right, and be able to talk to each of them, understand them, make sure mom's in a good place, because the parents are the ones who do the healing. We just help give them the tools and prepare them. And then we want to talk to the child. What's going on? Give us a full. Now, the first thing every child that walks into the UCC says is, there's nothing wrong, right? But after a couple of hours, after building a little bit of relationship, you get the true story, right? Whatever the anxiety, that's right. And so it takes a village, right, to put this sort of package together. We do it in about 4 hours. And then, you know, the families feel strong enough, secure enough to go home. And then we'll check in every day to make sure whatever plans were in place are working. And if they're not, come back in.
Which is
do
huge.
Another session.
It's huge to check in with the families and see how things are going, because they need their hands held, you know. And, you know, part of this whole process with mental health crises, you know, it's all about trying to, like you said, like evaluate the situation, de-escalate things, and then give them the tools that they need.
That's right.
And you guys are achieving that within 24 hours, right?
Yeah, so like I said, you don't need an appointment, you know. One of the things that makes us successful, and 97% of the kids that come to us don't have to go to an ED, don't have to be hospitalized, right? They're going home with the supports of their family. But one of the things that makes us successful is when you're dealing with mental health crisis, right? You need to get the care at the right time, right? Because it's not something that is constant, right?
It can be pretty imminent.
That's right. And so you want to be able to come in when the family's ready, when the child's ready, when that crisis struck, and begin the healing process. And then get connected to care and continue to sort of grow as a stronger family.
What a great resource. Hector, thank you so much. We're going to get you all that information up on your screen, I believe, right here. If you're looking for help, 1680 Albany Avenue in Hartford, and it's at the Village CT on social, thevillage.org/UCC, if you're looking for more information.
Yeah, that Village's Urgent Crisis Center is such an amazing resource in our community. So thank you so much, Hector, for the work and the work your team is doing.
Thank you.
All right.